stop me. Alrighty, so this is worksheet number 2. We're going to be reviewing white blood cells. So your blood consists of, oh dear, I can only show a portion of this. So these are basically things that when I read the textbook, these are things I thought was pretty important, but depending on what your instructor wants or what he expects of you is between you and him. This is just stuff that I was like, hey, let's organize this so when you do the reading, you can add stuff in. Another thing too is I try to leave space in the boxes for you to add stuff. So if you read stuff, you want to add stuff, go ahead. So we're going to start with neutrophils, which is about 54 to 62%, so a very large amount of your white blood cells in your body. And these are categorized as granulocytes. And what is the difference between granulocytes and agranulocytes?
They're grainy.
They're grainy, yeah. When you look under
A microscope, they're grainy.
Right, when you look under a microscope, they're kind of grainy looking. They look like sand in them. Agranulocytes do not. They're just kind of
They lack cytoplasmic granules.
granules. Great, wonderful. There you are. So neutrophils are super important because they're the first ones to arrive at the infection. They're also strong phagocytes, so they eat bacterial infections. So they're the first ones to arrive.
What is phagocytes again?
Phagocytes.
Have you ever played the game Pac-Man? Yeah. Yeah? That's how I remembered phagocytes. Is Pac-Man. It eats everything.
So phago means eat. So yeah, Pac-Man, here we are. Waka, 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 waka. Let's draw a ghost. Oh no. I'm running away. Okay, so phago means to eat and cyte means cell. So phagocytes are cells that eat like bacteria. So in this case, this is the phagocyte, is Pac-Man, I guess. And the ghost over here is bacteria. So this is what neutrophils actually, what they do. They basically come to the site of infection, and they, do I have it in this one? I'm going to scroll down really fast. Yeah, they partake in diapedesis. I had to remember how to say it. So diapedesis is basically where they kind of like step through the wall of the blood vessel and go into the tissue portion of it, because the tissue is where the infection is. If it's not in the blood yet, we don't want it in the blood. So diapedesis is as if I was to squeeze through this crack in the wall and come out. Like you can kind of like, I don't know, as if there's like a movie where you can just like squeeze through something and come out the other way. But that's diapedesis, is when you can step through. So that's what neutrophils do to fight bacterial infections. The next one is eosinophils. So something else too, if neutrophils are high, if you get a blood cell count, like if you're sick and they draw your blood, your neutrophils are high, that means you have a bacterial infection because your body produces a lot of neutrophils to fight it off. Eosinophils are also granulocytes. This is 1 to 3%, so not a very large amount of white blood cells in proportion to your entire body. These moderate allergic reactions. So allergic reactions is like when your body flares up. Eosinophils kind of tells you to like chill out. It tells you cool down, slow down, you're okay. Eosinophils are also phagocytes, but they're not very strong. They're pretty weak phagocytes. And also, in addition to moderating allergic reactions, eosinophils help decrease the inflammatory and allergic response. So if you have an allergy, your eosinophils are going to be high, as well as your basophils. Yeah, your basophils will skyrocket. Another thing that causes the eosinophils to increase is if you have parasitic worms in you. So a little thing that you can remember is like, ew, worms, ew, eosinophils. I don't know if that helps. Ew, worms. I think worms are fascinating, but Indeed. The next one is basophils. Basophils, so you can see, they don't take up a whole lot in your blood, less than 1%. These are also granulocytes. These release heparin to stop the blood from clotting because when you get exposed to an allergy or something, your body thinks you're sick, okay? And we'll go into this when you learn more about the immune system than anything, but your body thinks you're sick, but if there's nothing for your body to fight, your immune system gets really like pent up and really kind of like angry. I don't know how to say it. It's kind of like if a bunch of soldiers were like excited to go fight something and they come and there's like a goat and they're like, wow, what the heck? I don't know if that helps, but but you know, it's like they're all like, yeah, we're gonna go fight, and then it's like, this is just disappointing. So anyway, so heparin, so this is like, you know, an allergic reaction. Heparin just stops your blood from clotting, so, you know, it kind of allows the blood to flow a lot faster and more efficiently because it's trying to destroy something that's in the body. So you want increased blood flow to get it out. Basophils also release histamine to stimulate inflammation. Inflammation then causes vasodilation and increased permeability and bronchoconstriction. So with a so let's break it down. So inflammation. Okay, let's erase this. So what's vasodilation?
Vasodilation?
Yeah. What happens to your vessel?
Dilating of the
Yeah, your veins get bigger. They dilate. That another thing is bronchoconstriction. What is bronchoconstriction?
shortness of breath. Your bronchos constrict.
Yeah. So while your veins, exactly, yeah, your bronchos constrict. That's right. So while your veins get bigger, your veins will dilate. Your breathing tube, your bronchioles that lead to your lungs, those will constrict and those will get smaller. So it's harder to breathe. So which of these actually causes, so some people die of anaphylactic reactions. Which one of these? Not able to breathe or the vasodilation that kills you? That's what a lot of people think, but it's actually vasodilation. Because if you're completely vasodilated all throughout your body, you're not going to have any blood pressure. And if you don't have any blood pressure, your heart's not going to pump. So a lot of people think people with anaphylactic reaction, yes, they need oxygen. They need to breathe. And if you get a nursing question, it's always airway. Airway's always priority, just saying. But for real, though, you know, they need oxygen, that's true, but it's not them suffocating. They don't suffocate themselves. I mean, it can inflame and be really bad, but what actually kills them is the drop in blood pressure from the vasodilation. So that's interesting. That's fun. Anyway, basophils. And these increase in the number due to allergies. So if someone comes to the clinic, you don't know what's wrong with them, you do blood tests on them, they have high basophils and probably other symptoms, allergies. Next, we're going to move on to the agranulocytes and the lymphocytes. So as you can see, it says largest size and smallest size. By this, I'm talking about the diameter. Monocytes are like the biggest white blood cells, and lymphocytes are the smallest white blood cells. But, you know, there's about 3% to 9% of monocytes, total white blood cells, and there's about 25-30% lymphocytes. Are you have a question? Or are you stretching?
Yeah. So the monocytes are the largest in size, as in like
The diameter.
diameter.
Yeah.
Okay.
So this is like
But there's
normal.
more lymphocytes, which are small.
Yeah, for sure. There are more lymphocytes. They're just smaller. So this is your white blood cell, monocyte, lymphocytes. So you have more of them, but they are smaller. So that's something, but that's kind of convenient though, because now you know the agranulocytes are either the biggest ones or the smallest ones, but the granulocytes are kind of in the middle. They're all kind of the same size. If that comes up as a question, I don't know what your instructor expects, but okay, monocytes, agranulocytes, they are active phagocytes of bacteria. So phagocytes, again, we have the Pac-Man up here. They eat bacteria. They eat cell debris. They eat trash. Monocytes, you eat trash. That's your destiny. Yeah, there you go. Trash eaters, trash bags. And Monocytes increase due to the number of chronic infections, malaria, TB, and typhoid fever, which makes sense because when you have malaria, your blood cells are basically like bursting, right? We're having that hemolysis. We have a lot of red blood cell debris. So your monocytes, your body's going to produce a lot of monocytes to eat up and all that extra cell debris. TB and typhoid fever, you're also going to have a lot of debris and a lot of like just extra stuff. So if you get a lot of monocytes, probably one of those diseases. Lastly, we have lymphocytes, which is when we think of the immune system. Now, white blood cells are all in the immune system, but lymphocytes are your T cells and your B cells, which we will get into when we get to the immune system. So that's what you get to look forward to. So these are your T-B cells. T cells directly attack tumors and pathogens, while B cells produce antibodies. And antibodies basically do the work for B cells. If you have a high amount of lymphocytes, you have leukemia, which is like a bone cancer. And if you have a low amount of lymphocytes, you have AIDS. Because the AIDS virus destroys T helper cells. And you will, when we get to the immune system, we'll go into this. If you flip to the back, this is just some, this is just a list of what white blood cells do. So this question is stating, which of the below is not a function of white blood cells? White blood cells do not function in hemolysis. Usually, like I said, malaria virus does that, or a bacteria does that. However, the white blood cells provide immunity and antibody production. That's mainly attributed by your T cells and your B cells. They phagocytize, so this is your monocytes and your neutrophils. They engage in diapedesis, which is your neutrophils, slipping through your blood vessels and going toward the wound site. The inflammatory response, which is actually really awesome. We didn't go over that, but we'll do that when we hit up on immunity. But the inflammatory response with your basophils, and then chemotaxis is kind of like, so if you get damaged, if you get like a splinter or something, the cells around that splinter will kind of be like, help us, help us. So that's chemotaxis, is chemo meaning chemical, taxis kind of meaning like taxi, message. So it's when your destroyed cells are just saying like, hey, there's a problem here, and that message is carried as chemicals to the rest of your body so it knows what to do. So if you see any of those terms, that's what it is. Leukopenia is a low white blood cell count. This one's asking you for the correct word, and leukocytosis is a high white blood cell count. So throughout all this, I think you probably know that leuko leuco meaning white in Latin, cyte meaning cell. Shoot, I can't spell cell. And then, so leukopenia. Deficiency. Penia means deficiency or decrease, not enough. And leuco means white. So this means you don't have enough white blood cells, is leukopenia. And then leukocytosis is just, you just have too many of them when you break that down. So any questions over white blood cells? No? Alrighty then.